Call Dr. Ail Harrisburg by dialing area code 252-767-6848.
You can't know someone has COVID-19 just by looking at them, but you should know that everyone who wears a mask has a reason to fight it.
My daughter,
My health,
Mi familia,
my wife's high blood pressure,
my community, my friends,
my sister,
my son's asthma,
mi abuelita shopping.
my job.
respect for others.
Whatever your reason, get behind the mask. Learn more at covid19.ncdhhs.gov.
Health department. Is that the health department?
Yep.
WAR 1520 AM in Warrenton, North Carolina. WAR 103.5 FM. Super great morning to everybody. As you have just heard, a commercial that we've been running for months now, emphasizing the importance of everybody getting back behind the mask. And we have been talking for several weeks about the circumstances that are going on and happening with COVID-19. I am so proud and happy and excited to have in the studios this morning, as always, a panel of guests who I guess have their finger on COVID-19 here in Warren County, more or less more than anybody at all. So I want to say good morning to Dr. Margaret Brake, who is the Warren County Health Director, and of course our very own County Commissioner, Mr. Vincent Jones. And we're going to open up the conversation this morning and say, good morning to you, Doctor. How you doing?
I'm doing great. How are you?
Absolutely wonderful. County Commissioner,
I'm doing well, but you don't get me in trouble, Pastor Galloway. I'm the county manager.
County Manager.
Right,
Okay,
right.
I don't know why I want to say that. I guess I just want to give you a raise.
I got you. Let me make sure I stay in the appropriate lane here, all right?
I just want to put you in it. And it's going to happen, man, all right? Just hang on to that, okay, all right? Anyway, good morning to both of these wonderful people. And Dr. Brake, I am going to let you open up the conversation concerning what's happening here in Warren County. And we're going to sort of spread it out across North Carolina as we move along this morning. Good morning.
Good morning. So I'll just start by saying, since our last visit here, to give a COVID update, that we have seen our number of COVID cases increasing in Warren County, just as we have been seeing it increase statewide. As of today, we have 909 total cases of COVID-19. And I believe when we were here last time, we had about 566 cases. So we're close to nearly doubling the number of cases that we had since our last visit here to the radio station. So that is significant. We have 271 active cases in the county. We are fortunate in that many of the people who have contracted COVID-19 in Warren County have recovered.
That's good.
And we have 3 individuals that are in the hospital at this time. And I will say that one of the impacts on our COVID numbers is the mass testing that is occurring at the state prison here in Warren County, Warren Correctional Facility. So they have a significant number of positive cases at the state prison, and that is included in our numbers as well.
Okay. I wonder also, did the Thanksgiving holiday have anything to do with maybe the rise in cases?
Yes, so in addition to the numbers from the state prison, we are seeing significant spread just in our regular community. And I will just say, we typically do see increases in COVID cases after the holidays.
Mm-hmm.
So that's generally when the numbers go up.
Okay. So something that I saw, and I'm going to get over to you, Mr. Jones, in a few minutes. Something that I saw that was sort of blew my mind a couple of days ago from listening to the news is that, of course, we are in the red. Okay.
Yes.
As a matter of fact, I think I saw 80% of North Carolina is in the red. Okay. But something that sort of was mind blowing to me was that some of the larger counties, I think I saw Cumberland County, Wake County, and another county, they're still in the yellow. And we're such a small, I wonder how, I was like, How can that possibly be? Do you have any kind of?
Yeah, so some of this has to do with the size of the county. Okay, so you're a small county like Warren County,
Okay.
but you have a substantial number of cases,
Okay.
then that makes your case rate go up.
Okay.
So if you look at the report that you mentioned, the county alert system, we are in the red, and our two neighboring counties, Vance and Halifax,
Right.
are also in the red.
Okay.
But we do have smaller numbers, and so when they look at the case rate, so our case rate right now is 948 per 100,000 population. So if you kind of roll those numbers back to Warren County, we have close to 20,000 people. So that means about 95 people per 10,000 population is affected in Warren County, and that is high for our population.
Mr. Jones, how is the county manager? How are you guys playing a part in this?
Sure. Well, thank you for that. So we can't do this alone, and
Okay.
so we are trying to support each other. Meaning, we have to work with Dr. Brake as our public health director. We have to work with our emergency manager, and we also have to work with our towns that are here in the county as well. And so one of the things that the board did on Monday at their meeting was they wanted to just express to the community how important it was for people to observe the governor's executive order.
Okay.
Meaning the limit for gatherings, even with your family, it should be 10 people inside a building and 50 people outside. And so we just want to make sure that we are encouraging people, we're putting the appropriate procedures in place for people to know that we're trying to keep each other safe.
How do you think that the this time thing, 10 o'clock thing is going to play here in Warren County? How do you think that's going to play out here in Warren County? How does it affect Warren County? We
Right.
don't really have a lot of stuff going on.
Right. Well, we do have some businesses that can stay open late, and for us, we think we saw a difference. When this first started, we have been under the pandemic now for about 9 months.
Mhm.
And if you remember early on, when this was new to everyone, there was a stay-at-home order in place.
Mhm.
Warren
Mhm.
County had a
Mhm.
curfew.
Mhm.
We saw less traffic,
Mhm.
and we think that helped keep our numbers down early on.
Mhm.
I think now, 9 months later, people are getting a little bit fatigued with the whole
Mhm.
situation, so they're venturing out more, and now you're going to see more community spread.
Mhm.
So hopefully this will just again raise the alert for people, realize that they have to watch their exploring outside of their
Mhm.
home, because one of the things we want to do is make sure we just lessen the transmission. So hopefully it'll help. We think it will.
What are some of the? I know somewhere along the line, and when this thing first started, there were like maybe a couple of several symptoms. But I think as it progressed, it seemed like the symptoms sort of would changed or widened. So what are the symptoms now? That
Yeah, so the symptoms were very narrow at the beginning,
Mhm,
as you
yeah.
said, but now they have been expanded, and much like the flu. And so that's why we are encouraging people to get the flu shot, because that not only protects them from flu, but if they happen to be exposed to COVID-19, it could help lessen the severity of their illness. So it's very much the same flu symptoms: headache, fever, fatigue, nausea, all of those types of symptoms. One unique thing to COVID that we're seeing in some of our patients is that they have lost their sense of taste and smell. So that is a unique symptom to COVID that we are seeing, but it's very much like the flu symptoms. And so if individuals are sick, we do encourage them to go ahead and call your primary care doctor and get it checked out, because if you go get tested, some of the tests now will, when you get the test, will not only test you for COVID, but it will rule out if you have the flu as well. So it's important to go to your primary care doctor and get that determination to make sure if you have the flu or if you possibly may have been exposed to COVID.
One of the things, Mr. Jones, that I'm seeing a lot of response and conversation on are the schools in the school system here in Warren County, school system in North Carolina. Where do you have any idea, or where do you see? Are you getting any kind of feedback or any kind of information as far as what we can look for as far as the schools remaining closed or remaining or opening?
Sure, I will have Dr. Ray help me out because she's been participating in the
Okay.
schools, but I don't envy them at all. It's a difficult decision.
Thank you.
And they have been working along with Dr. Brake, trying to take a look at the data to see what they can do to keep each other safe. But it is my understanding that they decided that they would remain virtual until sometime in January, where they'll revisit it again to decide if they want to do some other model for learning at this point.
Yes, and so just to add that to what Mr. Jones said, the board at their Tuesday evening meeting did discuss school reopening, and I really commend the school system, Dr. Young and Mr. Andre Stewart in particular, who have been leading the school reentry committee.
Okay.
And that team has been looking at every aspect of school reentry and what that means for Warren County. And so they were able to present a very well-rounded presentation of options for the school to reopen. And the board did make that decision to delay the reopening face-to-face in-person instruction, and just to continue with remote learning until their January meeting, and at that time they will revisit. So it is a tough decision to make because we know the benefits of kids being in school
Right.
and in-person learning, and at the same time you have to weigh that with safety for not only the students but for the faculty as well.
Because I'm looking at a lot of states that went and opened up schools either on a partial thing or either a full schedule, and they're having to fold now.
Absolutely.
Because, it just became, just really, it became really bad.
Yeah.
And it's something, so how is it affecting, how is this COVID affecting our young people, our kids?
Well, in terms of actual transmission, we are seeing that we have young people who have been impacted by COVID-19. So be it, someone in their household had it, a parent or another adult, and transmitted to the children. So I think it does have a profound impact on children, whether they actually contract the virus or even just the mental issues associated with having to be home to, do your work remotely, and just to deal with the normalcy of being a kid and how that has changed in terms of the things that we all could do and now we're not doing as much of. So I think it does have a profound impact, and I think all that we could do to support parents and children at this time would be important, really helping them to understand what this pandemic is all about.
Account manager, do you see, we don't, like I said, we don't have that many businesses that are open after 10 o'clock. We have a few here and there. But do you see any change in some of the stores that are open now? Do you see any kind of change coming that will affect, the time that maybe like the grocery stores? Because wasn't the grocery stores closing early one time when we first started this?
When we first started, they were, but they were listed as an essential business,
Okay.
and so they were allowed to have some different operating parameters versus other places that weren't deemed essential.
Okay.
But for right now, we don't think that it will negatively impact most of our businesses. We do have some that are staying open a little later, and so for us, there really is no way around it. We want you to observe what was in the governor's executive order. So between 10 p.m. and 5 a.m. at this point, we have a modified stay at order. So we need everyone to.
So that is. I think it's supposed to start
Tomorrow at 5 p.m.
Okay, and then because at one time I know also we had to, if you had to maybe be out early in the morning, so you had to have like some type of note or something. Are we there yet, or?
The executive order will identify what the exceptions are.
Okay.
And we did have a few calls in the beginning about whether or not you needed a note or not.
Right, okay.
We didn't provide people notes because the executive order identifies what the exceptions are. But if you are going to use one of those exceptions, then you have to be aware of what it is so you can use it. But we weren't giving notes, but you just have to be aware of what the exceptions are. And if you have questions like that, you can call us and we'll try to help you walk through those issues just to make sure that you're not in violation of the executive order.
How do you think, Dr. Brake, how do you feel that that executive order covers us here in Warren County, because we're concerned about North Carolina as a whole, but we have to be concerned about what's going on at home. So I know a lot of people travel here, there, everywhere. So how does that maybe play into what's going on here in Warren County? Does that play a part? Or do you have any information, any numbers on that?
Well, I think it does play a part because many of us, even those of us who live in Warren County, work outside of Warren County.
Right.
So we have a lot of people that don't work in the county. So there's always movement, whether we're going to work or taking care of business as we need to. And so all of that increases your possibility of being exposed. The more people you're around, the more likely that you could be exposed. And so that's one of the issues behind asking people to like limit their social circles. If they have events at their home, to limit that. If you have family gatherings, to limit it. The executive order still remains 10 people indoors, 50 people outside. So that has a significant impact on the case number. So the DHHS has put out information on how to safely celebrate the holidays, and I'll leave that with you so that you can share that with the staff. But again, the 3 W's are really important. And then when you look at the county alert system report and look at some of the data that's in that, one of the counties that is doing really well is Orange County. And they credit their success because their residents are actively practicing the 3 W's. And so their rate of transmission is much lower, even though they are a large county, like Wake County and Durham, but their numbers are much lower, and they credit it to the fact that their residents are following the 3 W's. So I really just can't stress how important that is for us to do that, to wear a face covering, to wash our hands, and to social distance, wait at least 6 feet from others. That is critically important. And we have seen, where that has helped many communities to keep their numbers down.
I'm working on outside of here. I'm working in a retail store, man. Sometimes I just be wanting to slap people. I say, put that mask on.
Right.
But what we've started doing is we have masks that
You give out.
we give out. I see a lot of, I think, Food Line does this as
They
well,
have started that, yes.
to do their part in it. Because I feel like some people, once again, I still think that a lot of young people, they really are not getting the message of how important how serious this thing is, man. I'm still seeing them, just walk around. I'm still seeing them congregate. I'm still seeing them, come in and out of stores with no mask, whatever on. I don't know really what else we can possibly do. It's on the radio, it's on the TV. It's everywhere on how important, how serious this disease is, man. So also I looked at between now and I think I saw that between now and January will be the most critical months that we will have to deal with this COVID-19. Why is that?
Well, right now we're in the midst of flu season, for one thing.
Okay.
And so we have a lot of people that are contracting the flu and in the midst of that, COVID as well. So that is really critical, and it's also critical because we're on the verge of having a vaccine. So the hope is that once the vaccine is made available and people start to get vaccinated, that would also help decrease the number of cases.
Okay. How do you think Warren County is going to play as far as the vaccine is concerned?
I think people have different opinions when it relates to vaccines. But quite honestly, at this point, if there's anything that we can do to keep each other safe, I think we're going to have to maybe put some of that hesitancy aside and err on the side of, keeping yourself and your family members and the community safe. So for me, there is no question. If there is a vaccine and they indicate that it's safe for people to take, then we need to be, responsible and try to get vaccinated. And I know that Dr. Brake is working on a plan for what that looks like here in the county.
Okay, I want to pause here and just say, God's blessings and kudos to our first responders, man. These guys, men and women have just been really on point, just doing the, they continue to do their job every day.
Right.
Hospital workers, daycare, rest homes, and everybody that's really, like I say, on the front line.
Right.
I really
Right.
commend them, and so I think to all the reports that we're getting, is they will be the ones who will have the option of receiving the vaccine first.
Right, yes, so there is a plan for vaccination, there's a state plan, and then the counties will also feed into that.
Okay.
So, you're right, when the vaccine is made available, everybody won't be getting it at the
Right.
same time. So there are different phases of the framework for vaccination. And phase one, the primary groups are healthcare workers, and of course, that's a broad range of all those people that you just mentioned. And it also will include our long-term care facilities, like our nursing homes, staff, and residents. So all of those people will be in that very first phase of vaccination.
This correct me if I'm wrong, but I think this started with, I think the news that I got was like, the first vaccine was like given in the UK,
Yes,
if I'm correct.
that is correct.
And it was like a 90-something-year-old woman.
Mhm.
Okay. Now, what blew my mind, and this is not really to push it about your way, was after they gave the vaccine, I guess to several people, then they came back and said that there may be different underlying health issues of people that you may not want to take it.
Mhm.
Do you have any information on that? I think it's something like with people with allergies
Allergic
and
reaction.
something like
To the
that.
vaccine.
Yeah.
Yeah, I don't have specific information on that, but what I will say is, with the vaccine, they have trials, so they try to see how effective it is, which the effectiveness has been very well, about
Yeah,
95%. But then you also have to consider, just like the flu shot, everybody reacts differently to the flu shot.
Okay.
Like some people have no issues, some people, have a few side effects, or some, have nothing at all. So I think we can look at the vaccine the same way. I mean, everybody who takes it may not be affected the same way. I mean, but the efficacy of the vaccine is very strong.
Right.
Is very strong. So I think as the vaccine is being rolled out, that the state and the FDA will continue to monitor
And they're
how it's working in the community.
test it more.
Yeah.
And as the results come in, I'm gonna wait for the results to come in. So I know exactly what to do. Because to each is on. To each is on. The rate of it. Some companies are saying, some are saying 85, some are saying 92, some are saying 94, some are saying 90, some are 95. How far along do you think we will be in this having to deal with this vaccination issue? How far do you think this is going to take a minute?
Yeah, I mean, I think the vaccine won't be a miracle cure. I mean, it's kind of like the flu. I mean,
Okay.
we still have the flu after how many years? And I think it might be something that may not go away, but it may be something that we will end up treating just like we do the flu. So I think while we're excited about the vaccine, we still want people to know you still have to do the strategies, because that's important to keep people safe. Everybody's not going to get the vaccine,
Right.
because we know some people may not want to. So we still have to do those other things to keep each other safe in lieu of not having the vaccine.
Go ahead.
I agree with Dr. Brick. I think we just need to kind of see how the rollout will work for us, and we will be there to, participate where we can to keep our residents safe, and for those who choose to participate in the vaccination process.
You have something very important that's coming out as we bring this to a close. Something very important that's happening on today.
Yes, so this afternoon from 2:30 to 5:30, we will be having a community testing event for COVID-19. It's going to be in the parking lot of the Warren County Health Department, which is at 544 West Ridgeway Street in Warrenton. And we encourage anyone that would like to get tested to come to this event. You just need to bring your ID and your insurance card if you have one. If you don't have insurance, you can still get tested. You don't have to have a copay or any out-of-pocket expense. So we want anyone who would like to get tested, if you have symptoms or you think you may have been exposed to COVID-19, we certainly want you to come and to get tested. And I do just want to give a quick shout out to our co-sponsors with us, Hope Regional Medical Clinic, Cooks Chapel Baptist Church, and also Snow Hill Baptist Church. So really want to thank Dr. Cozart and Reverend King Perry, who are the pastors of those wonderful churches here in Warren County, and also the NCCU Accord program. So just really thank all of our sponsors and the community in whole. We've gotten a lot of support for these events, and we are excited that we're able to continue to offer community testing. I think that is really important to make sure that we have testing available to all residents in the county.
Mr. Jones, before we go, what kind of questions are people calling you with concerning? Do you get many questions concerning?
Initially, there were questions,
Okay.
and a lot of the questions were around what we talked about earlier, the curfew, and what people were allowed to do, and what were the exceptions, because it was good to hear those questions. People wanted to make sure that they were following the governor's executive order, so we appreciate that. But as this has gone on, the questions have slowed a bit, but we still have the hotline available. That number is 252-257-7132 if you have questions. But they run the gamut from, like I said, the curfew, and they ask about testing as well. So we've had all sorts of questions come in.
How important it is before you go for us to get tested between now, since we're getting ready to go into the Christmas holiday.
Okay.
How important it is, or does it really make any difference at all?
Well, I know some of the guidance that has come out from the state is that if an individual is planning to travel, the recommendation is that you get tested 3 to 4 days before you travel. And so at our last testing event, which was right before Thanksgiving, we had quite a few people who had called and said, hey, I'm planning to go out of town, can I get tested? And so that is highly encouraged, particularly if people are planning to travel, that they get tested prior to going, just to give them some indication if they've been exposed or not. And then the other thing I would say also is, if you get tested, you really shouldn't be going out. You really are supposed to wait until you get your test results.
Okay.
And we have had cases where individuals have been exposed. They got tested, they didn't stay home and wait to get their results, and then they were out in the community, or they were at work and exposed to other people. So it's really important, if you get tested, to try to stay home until you get your results. If you have to go out, please wear a mask, but if at all possible, please try to remain at home until you get your test results.
And as those who would get the test results today, they will be notified when?
They will be notified generally 2 to 3 days following the test. And Dr. Russell's office would be calling them to give them their results.
Any last words? Yeah.
I would just like to say thank you. We appreciate the continued support that you all have offered us and helping us get the word out to our residents.
Thank you all as well.
Yep, and I just want to thank our county residents. Those who are following the strategies. We get calls from residents, and they give us their complaints too.
Okay.
Say, for example, if they go to a restaurant and they walk in there and nobody has on a mask, oh yeah, they call and say, I can't believe, people are not following protocols. So our residents are very much aware of a lot of these issues that are going on. And so I just encourage everyone that it is extremely important that you wear a mask while you're out in public and limit your circles, because we are seeing community spread from people having dinners and things like that, where they have folks coming in who do not live in their household. They may be family members, but they may be from out of town as well. So it's very important that you kind of adhere to some of these strategies and practice these guidance. So I do thank the residents for their continued support and continuing to try to follow the strategies. We know people are getting tired. We all are, but we know that in order to keep each other safe, the research says we need to do all of these things: wearing a mask, staying 6 feet apart, and washing our hands. So I thank the residents, and I just encourage everybody to continue to do so.
I think we need one of the snowstorms like we had in 2018.
That'll slow us down, right?
So you can't go out.
Thank you, Dr. Brake, for your time. Thank you, Mr. and Mrs. Jones, for your time. Thank you, Charlotte, for behind the camera. For y'all who don't know, who's recording all of this. Mrs. Charlotte Duncan is over there. She does all the great videotaping of everything that goes on. I want to thank you guys. I'm looking forward to talking with you all again, maybe after or so long after the event today, and sort of bring us back up maybe before Christmas or something.
Okay.
Okay?
Sounds good.
Thank you guys very much for
Thank
your time.
you.
Thank you
Appreciate
for everything that you all do in your professions.
Yes, sir.
Really appreciate you guys. Thank you.
Thank you.